I'm Dr. Darlene Chalmers. I am a therapy dog handler. My dog Ruby is here. She's been with the program since 2017. I've been a handler since 2015, and I'm going to facilitate the session this evening. So before I start, I do want to acknowledge everyone that's here this evening, and including the animals and the land that we're all on. The majority of us are coming to you and presenting from Treaty 6 territory and the homeland of the Métis. And importantly, we pay our respects, so thank you. So just for everyone who's here, that we do have therapy dog handlers who are going to be live on the Zoom chat. So any questions that you have, you can share those, or any stories you want to share. You know, we're going to come back to this throughout the presentation, but feel free to put anything in the chat, and we have a number of people who can respond to questions or comments or anything that you have. So we have 7 people here to present different pieces of information, and I will sort of facilitate and move people along through this session. I want to turn to Michael Brenholland, and Michael is the Director of Operations at St. John Ambulance. So I'll pass it to you, Michael.
Thank you, Darlene. Welcome everybody to this wonderful session, and kudos to all the people who organized it and worked hard to put it together and recruit all the wonderful people and resources that are here gathered tonight to address your questions about the program. I'd also like to welcome you to St. John Ambulance. And just to give you a bit of a background, St. John Ambulance is, well, we don't have any ambulances, let's put it that way, not in Canada. But we got the name first because our organization is over 950 years old. Had its starts way back in the Mediterranean, and at one point we actually had 200 naval vessels as part of our organization to suppress piracy in the Mediterranean. So we've kind of evolved as an organization since then, and these days we tend to just do first aid classes on a regular basis and do a lot of rescue training. And the funds from that go to support programs such as the Therapy Dog Program. And the Therapy Dog Program is a very important part of the St. John Ambulance family. And it really does improve the health and safety of our communities to have the therapy dog teams out doing their job, doing their thing with the people and helping them out. And I'm glad that you're all interested in becoming a part of this wonderful organization and this wonderful division that does such important work. The program started in 2007 in Saskatchewan, and since then it's grown into quite the beast, so to speak. And we have all kinds of interesting work that's been done by a number of the panelists that are here tonight, and they'll be sharing that with you. So I look forward to meeting some of you in the future, and I'm looking forward to hearing more great things about our therapy dog program as it grows even further in this province. Thanks, Darlene.
Thank you, Michael. That's great information, important for people to understand the context of St. John Ambulance here generally and here in Saskatchewan as well. Thank you. So I'm going to turn to Ben Carey, and Ben is great with technology. Ben does many things with the program, and we're so grateful to have him be a part of this. Ben coordinates the Pause Your Stress, the visits on campus, the U of S campus. He works with the virtual visits, setting those up, as well as coordinating the visits where we've been at Prairieland Park with vaccination clinics and many other things. But I will pass it to Ben to share just what a therapy or who a therapy dog team is, what they do, and where they visit. So I'll pass it to you, Ben.
Great, thank you so much, Darlene. Yeah, so I would like to talk about what makes a therapy dog team and what makes it so special through St. John's Ambulance. And so to kind of talk about the components of it, to start with, obviously, is the therapy dog. Generally, they are gentle, calm, though some are quite excitable as well. They love people. They aren't very fearful of new people or new places, and they just really enjoy visiting with people. But what makes St. John's Ambulance so special is that it's a therapy dog team. So we're not only evaluating the dog, we're going to be evaluating the handler. And so the handler is really the other half of our therapy dog teams. And that would be you, if you go and visit with your dog. So the handler is going to be somebody that's going to be interacting with all sorts of people in all sorts of environments, where you go to so many different places, and I'm going to touch on that in a minute. But we are going to be interacting with vulnerable people. We are going to be interacting with people from all over the globe, and people with different sensitivities, and people with different knowledge about dogs and all sorts of other things. And so when we evaluate the team, we talk to you, and we expect not that you'll know everything, but just that you will be kind and patient with everyone that you come across. And your dog will be as well. So what do our teams do? Well, our therapy dog teams are really here to bring wellness to people and communities. And often it's going to be the people and communities that are the most vulnerable. Our therapy dog teams work by allowing people to meet, pet, and play and interact with their therapy dogs. And this increases feelings of wellness. This reduces feelings of stress. Sorry, I'm just, and it just increases our feelings of love, and takes us out of maybe scary situations. It maybe makes our good day even better. It's a great way to interact with an animal. In our research, we call it human animal interaction, or ZUAIA. And it's just this combination of allowing our animals to make us feel better. We have found through our research with our team that it has tons of benefits, including feelings of unconditional love, support, ease feelings of loneliness and depression, and reduction of pain and anxiety. So as a team, as you being a team, you have the option of going to many different places. And the great thing about working with St. John's Ambulance is where you go is dependent on you. We're never going to make you go somewhere, but we will provide you with places that we do visit. And any organization, any place that feels like that it would benefit from having a team join them, can ask St. John's Ambulance to set up a team for them, and we will put that message out to you and offer you if you'd like to go. But the places that we have been going include vaccination clinics, mental health facilities, hospitals, senior care homes, safe spaces such as women's shelters, events like football games, those kind of things. Universities, the Positive Stress program at the U of S has been going on for many years at this point, has been wildly successful, especially with students that are dealing with finals and all sorts of things. They just need that unconditional love that's supplied by a therapy dog. But we also have gone to emergency situations. Many of you will know about the Humboldt crash that happened a few years ago. And our therapy dog teams went to Humboldt and went to the hospital, went to the hospitals where the people were sent, which wasn't necessarily Humboldt, it was the surrounding hospitals, and visited with those families, visited with those nurses and doctors, and have been in these situations where these people really needed this unconditional love and support. Michael is actually setting up another program, which is an emergency situation program that is allowing therapy dogs to go into places that might experience flooding or catastrophe, and you can sign up for that as well to bring the support to people that really need it. But really, at the bottom line is, anywhere where there's a need, people can ask for a therapy dog team, and we will do our best to bring a team to them. And I think that's something that's so great about our program. That's it for what I have to say. Thank you so much for letting me speak.
Thanks, Ben. Appreciate your comments and sharing that information for everyone. So we'll go to Mary Ellen Gibson, and Mary Ellen is instrumental with the Pause Your Stress and other aspects of therapy dogs, human-animal interaction, which is part of the therapy dogs as well, and particularly around the therapy dog teams that are visiting online. So I'm going to ask Mary Ellen to speak to that virtual option.
Great, thank you, Darlene. And I'm guessing participants are thinking, what Ben said is fantastic, this sounds amazing, but what about during COVID? So with the pandemic, we all realized that we wanted to make sure that our handlers, anyone that we were interacting with, and our dogs were all as safe as possible. So we suspended our visiting when COVID really hit. But then in the summer of 2020, we decided, why don't we take this online? Many people were feeling isolated, and we thought maybe the therapy dogs could make a connection in this virtual world. So we brought the therapy dogs online. Many of the handlers who are here today to answer some of your questions were part of that. This all happened through Zoom, with our community members being able to take part and visit with different handlers and their dogs. And this also was an opportunity for us to really increase our social media presence. So you can find us at therapydogs.ca, which is one of the logos behind me, where you can find tons of amazing videos that were created by our handlers with their dogs, as well as reading videos where the dogs and handlers read books together. And so these, along with our social media through Facebook and Instagram and YouTube at Positive Canine Connections now, you can see some of the amazing things that we did to engage our audience, as well as meeting them online. But we didn't just meet people online. We wanted to meet some of those other locations that Ben was talking about and try and engage with them like we would have liked to have done in person. So this included what we lovingly call our flat dogs, which are 2D posters of our dogs as close to real life size as possible that went up in the Royal University Hospital, the Dubé Center, and the Ronald McDonald House here in Saskatoon. And this also included a prompt for people to go to our website, check out the dogs, and meet them online. And maybe something that you've noticed or heard about is that we are also in the vaccination clinics. So that started just this past year in August, where we were lucky enough to get an exemption for our therapy dog teams to go in and support people who may be anxious, stressed, or fearful about getting their COVID-19 inoculation, as well as their influenza vaccines. So if you have any questions about that process, please throw that in the chat. It's been absolutely magical to see the teams that are able and willing to take part in this particular program engage with everyone from young kids to some of our elders who are getting these shots, and how much it's really been impactful, not only for the patients, but also the healthcare staff that are in a fairly stressful environment. And we hope that this amazing opportunity will bring to more and more opportunities for us to be involved in the healthcare field and to support our frontline workers. So with that, thank you so much for hearing my piece about online and virtual visiting. If this is something that you're interested in, this is something that we do want to keep up and have the option for handlers and their teams to visit with people at online meetings and in other formats. Thanks so much.
Thank you, Mary Ellen. And it has been exciting. You know, those opportunities to do virtual visits that keeps and maintains connections between people in the community who may be isolated and the therapy dog. So it's been just such a great program in that way as well. I'm going to turn to Stephanie Peachy, and Stephanie is the coordinator, the volunteer coordinator here in Saskatoon. And Stephanie's going to share a bit more. We'll give her a bit more time to talk about the therapy dog evaluation and what actually happens when you come to that point and moment as a therapy dog team. So I'll hand it to you, Stephanie.
Thank you very much. Go ahead and play the orientation video, and then we will talk about it.
This video will demonstrate what to expect when you and your dog are evaluated to be a St. John Ambulance therapy dog team. Test number 1, meeting the evaluator. The evaluator will greet the handler first and ask permission to pet the dog. The evaluator will then pet the dog, check his feet, pet his head, check his ears, and run her fingers through the dog's coat. Test number 2, walking the dog. The handler will be instructed to walk the dog in an L pattern. The evaluator will have the team halt at various points in the pattern. When in a halt, the dog does not have to sit, but should stay reasonably close to the handler. The team should have a loose leash throughout the exercise. Test number 3, praise and interaction. Handlers are encouraged to bring the dog's favorite toy to this part of the evaluation. The handler will get the dog excited for approximately 10 seconds while holding on to the leash, and upon instruction from the evaluator, will tell the dog to stop play. The handler may use more than one command, but must demonstrate that the dog's excitement level is brought down in a reasonable amount of time. Test number 4, milling crowd with props. A minimum of 5 people will move in a random pattern to symbolize a busy senior home. Speaking loudly and using mobility aids such as walkers, crutches, and canes. The handler and dog will walk through the crowd 3 or more times, taking care to not cut anyone off. Test number 5, advancing crowd. The handler and the dog will stand in the middle of a circle of volunteers. Upon command, the volunteers will advance toward the dog with their arms outstretched and fists closed. The volunteers will move in a friendly, non-threatening manner. All dogs should remain on the ground for this exercise. The handler may choose to kneel close to the dog to relax the dog throughout the exercise. As always, the handler may keep a hand on the dog's collar for greater control. Test number 6, stationary crowd scene. Volunteers will form a circle within the test setting with mobility aids such as canes, crutches, and walkers. The handler will walk around the inside of the circle twice with the dog, introducing the dog to everyone. Be aware the petting can be a little harder than the dog is used to, so we can simulate what may happen in a visitation setting. The volunteers may also be instructed to do things such as shake when approaching the dog, speak with fluctuations in volume or tone, or unexpectedly hug your dog. The volunteers may also be instructed not to pet the dog or to be frightened when the team approaches. Small dogs under 10 pounds may be carried by the handler for 1 round, so that volunteers attempting to pet the dog can have easier access. The evaluators are looking for a comfortable response from your dog without excessive lip licking or tail between their legs. The handlers are encouraged to talk to their dog. Test number 7, Comatose Evaluator in wheelchair. While going around the circle, a volunteer in a robe and hat seated in a wheelchair is instructed to join the circle and remain motionless for a period of time. The handler and dog will advance to the robed person approximately 2 feet away. The dog may either sit or stand. The person in the robe remains motionless and staring at the ground. The dog is observed for 10 seconds for reactions. At this point, the evaluator may ask the team to reapproach the person in the wheelchair. When instructed to do so, the robed volunteer will move slowly and extend his or her hand out to the dog. Test number 8, Combined Evaluator in wheelchair with distractions. The evaluator in a wheelchair approaches the sitting dog from behind and circles around the dog and the handler. The behavior of the dog is observed. The evaluator will then ask the handler if they can treat the dog. The handler cannot refuse. The dog may either take the treat gently or refuse the treat altogether. Please note, the evaluator will hold the treat firmly for a few seconds after the dog takes it before allowing the dog to have it. Immediately following the treat, an assistant will run or walk quickly across the room. Immediately following this, a person standing a minimum of 6 feet behind the dog will cause a loud metallic distraction, usually a bag of empty cans or steel bowls. The dog is allowed to be startled. The evaluator is looking for the dog's recovery from the noises. For smaller dogs under 10 pounds, the evaluator may ask the dog to sit in his or her lap as demonstrated. Test number 9, Handler Meeting Handler, or Dog Meet Dog. 2 teams are tested at the same time. Dogs need to be on the left side of their handler. The handler will advance to each other and shake hands to simulate meeting someone else in a hallway. It is the handler's responsibility to ensure their dog sits or stays before they shake hands. The dog should not be stretching to see each other, barking, or jumping up. To schedule an evaluation for you and your dog, please contact the Provincial Office of St. John Ambulance at 1-888-273-0003 or email at cs.coordinator@sk.sja.ca.
Thank you. Well, welcome all of you. We are so excited that we are going to actually be able to do some evaluations again and get some new teams in. It's been hard with COVID. We have lost some teams, so it's great to have some new teams. Now, when we do the evaluation, as you saw going through here, we have quite a few different things that we are testing you for. Generally speaking, what we really want to know is that we want to know how the dog reacts to certain things, such as loud noises, people running, crowded room where there's lots of people in it with yelling and screaming. How does the dog react? Now, dogs are dogs, and sometimes they get scared. I know that sometimes people get scared. We have banged the pots together and behind a person, and the handler jumps more than the dog did. So we expect that to happen. Don't be alarmed if your dog does react that way. But what we're looking for is if that happened in the hospital, such as an IV going off in the hospital with all of the noise of the IV, how is the dog going to react and how would the dog recover? We also want to see how the handler and the dog work together. So if the handler is scared, what does the dog do? Does the dog become scared too? What does the dog do? If the dog gets scared, what does the handler do to help that dog get over being scared? So that's why sometimes we do some of the things that we're testing is really just to see how the dog reacts, but also to see how you work together as a team. A lot of times what happens is that the handler comes to the evaluation and they're nervous. And when they're nervous, we always say that the nervousness goes down the leash to the dog. So what we want you to come to the evaluation with is a big smile on your face, thinking this is going to go well. We're going to get together. We're going to see what my dog can do. And probably you're going to have a much better experience. If we think at any time during the evaluation that we want to stop it, or if you want to stop it, you can stop it at any time as well. I know that one of the questions I always have about the evaluation is why do we offer a treat to the animal? And truthfully, when we are volunteering as pet therapy teams, or therapy dog teams, we do not offer any time to treat our dogs. We are there to visit. They get all of the support and the love from the petting. They don't need the treats. So we ask that nobody treats their dog when they are doing the visits. However, sometimes you will have people with food in their hands. Sometimes they may have food on their hands. Some of our nursing homes, the people may not get their hands washed, and there is food on the hand. So how can we see if the dog would bite the hand, or would they just lick off the food from the hand? So that's one of the reasons why we always do that one, is just to be able to say, yes, the dog is not going to bite. The dog would be gentle when they're taking it. So that's why the treat is. Generally speaking, it takes about half an hour long. However, when we do ask for you to get evaluated, we ask that you're there a lot longer because we kind of need to talk to you ahead of time and we kind of need to talk behind. And once this formal evaluation is done, the next step to that evaluation is to find a place of where you would like to visit. And then once you have found a place, you don't pass and become therapy dog handlers and therapy dog teams until you have gone to a place and had an evaluation right on site, right while you're visiting with your dog in the location that you would be visiting on a regular basis. So say that I was going to be visiting at the hospital, I would get this formal evaluation like the video was. Then the next step would be for me to go to the hospital. And usually it means the handler goes without the dog to see what the situation is, where you can take the dog, where you can't take the dog. And then after that, the third time, you would bring your dog. Somebody from St. John Ambulance, a representative would go with you, and you would talk and you would see and you would visit with the dog, with the St. John Ambulance person there to help guide you and kind of keep things going and help you with any little frustrations that you may have. Once that is done, then you are done and you will have been fully evaluated and you will become a therapy dog handler at that point. So it is kind of a three-step point. It's not just get this evaluation, you can go out and visit. It also must be when you visit, once you have decided of where you want to go, we have to make sure that there is a request in there so that we can visit there. So you may say, I would like to go visit here, but the organization may not want you to visit or may not want a therapy dog. So we have to coordinate that as well to make sure that we are taking our teams to where they are. Now, I don't have anything else to say. I know that there's been some questions and I will try and answer those now, but thank you very much for listening to me. At any time, please get a hold of me. And I would be more than glad to talk to anyone regarding the evaluation itself. Thank you, Darlene.
Thanks, Stephanie. And that's so very helpful, that information, as well as the video. And I've noticed in the chat, there are a lot of questions. And so we are responding to them. If your question doesn't get answered, please know that we'll have time at the end of the session for a question and answer as well. So I will move us along to Dr. Colleen Dell, and Colleen is going to share some information about what we've learned and what we now know in the research about therapy dog benefits. So Colleen, I'll let you take it away.
Great, thanks Darlene, thanks everyone. It's exciting to have everyone here and to be able to share some of what we're doing, so hopefully we can bring more people onto our team because there sure is a need out into the community. I'm a handler right now with Ruby, who lives with Darlene, and I have in the past worked with Annabelle, Sylvie, and Kisby, and all of them have passed now. And I have a new guy, EJ, who we're trying to get, we're working with to get tested just like everyone else here and going through that process all again. We have a strong relationship at the University of Saskatchewan, as well as with Darlene at the University of Regina with St. John's Ambulance. We do a lot of research to look at these benefits and find the evidence behind them. So we talk about the benefits as Ben did about the therapy dogs offering comfort or love and support to the individuals that we visit with. So we're always evaluating those goals, seeing if we're achieving those, what that means, what that looks like, and how we can do better. So we've published studies and we've done studies at the University of Saskatchewan campus, as other campuses actually across the country. We've been in senior facilities, we've worked in prisons and done a number of studies in there in Canada, but in Saskatchewan as well as Manitoba with their St. John's Ambulance Therapy Dog program. We've been in addictions facility, and most recently we've been in the emergency department and released a study this week on the impact of therapy dogs visiting in our emergency department in Canada. We've also written about the dogs as co-researchers, and I think the most important thing to take away from today is this is all about human benefits, but it's about animal benefits as well. And these are our dogs, and making sure that their welfare is at the center of everything that we do. And that's a lot of what the testing is that Stephanie talked about, but we make sure that that's really clear in all our research as well. And then Mary Ellen had mentioned that we have therapydogs.ca. So if you go to that site, there's a blog there. So certain handlers have written about their experiences with the dogs. There's just so much on that site. But I think the way to just kind of show you our research is, Ben, if you can show the video. This is just a 1.5-minute video of our recent findings.
Most people go to an emergency department because of pain. Emergency departments can be busy and confusing places, and the resulting anxiety can make pain worse. It's well known that spending time with animals can help humans relax, but can this happen in an emergency department? A team of researchers from the University of Saskatchewan hospital patients, and policymakers are working to determine whether dogs benefit patients during an emergency department visit. In the first of its kind study, 7 St John Ambulance therapy dogs and their handlers visited the Royal University Hospital Emergency Department in Saskatchewan, Canada. This clinical trial looked at the effects of a 10-minute therapy dog visit on patients in an emergency department compared to no visit. Patients were asked a series of questions to assess their pain, anxiety, depression and well-being before, immediately after, and 20 minutes after the visit. The study used a patient-oriented approach. People with lived experience of pain guided the research. Results showed that the group that visited with the therapy dogs had a bigger decrease in pain, anxiety and depression, and an increase in overall well-being, 20 minutes after the therapy dog visit, compared to the group that didn't visit with the therapy dogs. This important study has shown that therapy dogs increase patients' comfort and decrease distressing emotions.
So I'm just going to end by saying that all of our research out of the office is patient-oriented or community-based. So our team, that publication is huge, from veterinarians to medical doctors to researchers to therapy dog handlers themselves. So if you do become part of the larger St. John's Ambulance Therapy Dog program, there's lots of opportunities to participate in the research. Yeah, so we're really thankful for that and being able to put out the evidence behind what we're doing out in the community. So thank you, Darlene.
Thanks, Colleen. And that evidence is so important to our understanding that as we continue to go forward, not only for the therapy dog program here in Saskatoon, Saskatchewan, but it also informs therapy dogs all over the world, like all over the place, Canada, internationally as well. And we always want to be learning. And as Colleen mentioned, animal welfare is a priority. We always need to be putting the dogs at the forefront of everything that we're doing. So I just can't emphasize that enough. So I'm going to move along to Dr. Holly Mckenzie, and Holly is going to talk a little bit about the therapy dog application process. So I'll turn it to you, Holly.
Oh, thank you, Dr. Chalmers. So we've talked a lot about the evaluation, and that's a really important part of it. But before you even get to the evaluation, before you can book an evaluation with your dog, you first have to start with a bit of screening. So there's some paperwork, which I know is not always the funnest part about anything, but the purpose of this paperwork is to make sure that that the dogs who are testing already have had their health checked out by a veterinarian, their vaccinations are up to date, that the handlers, because you're visiting as a team, that you have your criminal record check and that you're safe to visit with different people, that you have some references that recognize that you would make a good volunteer. And so you just fill that paperwork out and you send it to the St. John Ambulance Training Center, and you can contact them for the application package. And I'm actually going through this process myself with my dog Opal, because I started it, but then, I didn't prioritize it because we weren't doing evaluations within COVID. And then all of a sudden I'm like, well, I have to get back to this and do this again. So that's the first step. And then reviewing the video that we reviewed today to go orientate yourself to like what the test is about, and so that you're prepared, so that you can be confident with your dog, so that you can do training to make sure that you are comfortable, you and your dog, doing those different things, and to pay attention to your dog around those different activities to see, are we really a fit to be visiting as a team, and do that self-reflective work, which is really great. And then you'll of course do the evaluation, which we've talked about. And that evaluation, as everyone has talked about, I know we've said it a few times already, is really focused on making sure that the dogs who are visiting in therapy as therapy dogs in different places where we don't usually see dogs are safe to be there, are comfortable being there, and that it's something that they that is not taking away from from like what they want to do in the world, right? So just that's what we mean when we say we want to have animal welfare at the forefront, is we don't want dogs out there doing jobs that they're not comfortable doing, that they don't enjoy doing. And so, because we know there's lots of therapeutic beings out there that maybe don't necessarily want to go to a busy emergency department and that kind of different thing. And of course, it's also evaluating you as a handler and you two as a team. And then there's, you know, as we talked about that evaluation, then the placement. And so before you visit there as a team, even, you're going to be connected to wherever you would be visiting, whether that's the emergency department or whether it's a community-based organization. You're going to go there and you're going to walk around and do a facility tour. And depending on the place, like for instance, if we're talking about places that are Saskatchewan Health Authority facilities, they may have their own volunteer orientation themselves that you'll also do to be a volunteer at that organization. And so, but for some places, it's just as simple as doing a quick walkthrough, seeing where you're going to be visiting, getting a sense of the place. And that's really important for things like, you know, you might think, oh, I would really like to visit here, but you get there and it's maybe too busy for you and your dog, or maybe it's too small of a space. I have a 130-pound Great Dane, so I feel like this might be more of a concern for myself than other people. But yeah, so just like getting in there and seeing what the space looks like, seeing how you can navigate it with your animal, learning about what their processes are and making sure that that's clear, finding out when you need to check in with staff, all of those different aspects. And then you bring in your dog and you do a supervised visit with an experienced handler, and you would go in with your dog and do a supervised visit. And that's, again, the second part of that evaluation. Now, at certain places like emergency departments, because they're so busy, there's actually there's a bit a slightly different kind of process where at the emergency departments, you actually would go with an experienced dog handler team the first time and do the walkthrough with them. And then you would come back and do a supervised visit with you and your dog. But that's just because it's such a busy place to visit. And then you would determine with the volunteer liaison there when you're going to regularly visit, and you would regularly visit, but you continue to check in with your staff liaison there and check in with them about how things are going and stuff. So, and you can connect with St. John Ambulance. Something that's really wonderful about the group here in Saskatoon is there are usually monthly meetings where there might be sometimes there's people like myself and Dr. Dell or Dr. Chalmers talking about research, but there's also those opportunities to connect and talk with other handlers and to learn from different experts in the areas of animal-human interactions and therapy dog visiting and different things like that. So it's not that just as soon as you're visiting somewhere that all of a sudden that training and that support stops. It's kind of an ongoing process. So I'm just going to check in because I had a little bit of car trouble today and ended up getting home about 10 minutes before this presentation. So I'm just going to check with my colleagues and see if I missed anything. Okay.
That covered it. Thank you so much, Holly. Really well done in spite of car trouble. So thank you for that. That was very helpful. I'm going to now go to our final panelist, and Jane Smith. And you might have noticed there was a therapy dog handler team in the short video about the emergency department that you saw. That was Jane and Murphy. And Murphy is on the chair. He looks like he's having a bit of a snooze, Jane. Jane and Murphy are long time. They visit a lot. They have quite a storied history with St. John Ambulance as a therapy dog team. And I know that Jane will share a little bit of that with you, but Jane and Murphy are incredibly well known around here. Jane is also sort of volunteer coordinated in Saskatoon here and shared that with Stephanie, and both Jane and Stephanie are incredibly active in ensuring that the program runs very, very smoothly here in Saskatoon. So I'm going to hand it over to you, Jane, and Jane is just going to talk about why it's been meaningful for her to do this volunteer work, and why it's meaningful for Murphy as well. So I'll hand it to you, Jane.
I have to unmute myself first. Hi, everybody. It's my pleasure to be the last of the formal speakers. We have others that will share stories with you if you ask them. I think I get the best part because I get to tell you stories. So Murphy and I are actually the first to visit an emergency room in all of Canada. And we've written a storybook called Murphy Mondays about that. So we feel very privileged to be a part of this program. People often say to me, "You're not paid to do this job?" I said, "Yes, I am, but not in money. I am paid in watching people's faces light up, even through masks, to see people feel less pain, less anxiety, feel less depressed, and feel better about where they are. And I get to watch that magic through my dog. I get to facilitate that magic. And my dog loves being on the beds. That's his favorite spot to be. His favorite spot is to be snuggled up to somebody with his head across his belly. So I get to tell you some stories, and I'm going to tell you 4, and 2 of them are short-term benefits and 2 of them are long-term benefits. So the first one is, we've been visiting, by the way, since the fall of 2014. So Murphy's been doing this since he was 2. So we've been doing this for almost 8 years now. In 2015, when we first started visiting the ER, there was a gentleman on a gurney who was agitated enough that they were at the point of having to either medicate him or restrain him. And the physicians remembered that I was present with Murphy. They called me over. The gentleman welcomed Murphy up onto his bed. He patted him from head down to the tail. And we talked dog stories. And after 10 minutes, the gentleman didn't need medication or restraints. That felt pretty good. And Murphy was pretty excited. Another time in the pediatric emergency, the pediatrician asked me to help him as he had to stitch up a laceration under a child's eye. So I had the physician position the child how we needed the child to be on the bed, and then I figured out where to put Murphy. So Murphy's head was about 10 inches, no more than that, on the bed with the child. Somebody has asked about protection, so everybody washes their hands before and afterwards. There's lots of things we do to prepare with washing our clothes and brushing the dog, and there's incontinence pads on the bed to provide a barrier. So the child is 10 inches from the dog's head. There is a needle going in the child's face. There is blood spurting out, not on Murphy, and there's stitching going on. Murphy never moved a muscle. So I don't know who was happier in that situation. The child who got to pat the dog and hear dog stories while this was going on, the parent who was in the room, the physician whose job was easier, the dog who got all the pets, or me who got to watch it all. So my heart fills every time these things happen. 2 long-term benefits, so those are short-term visits, people we only saw once, but there's lots of times that we visit people week after week and for years. And there was one gentleman in the Dubé Center we visit who had not only mental health issues, but cognitive challenges as well. And every time we walked into the Dubé Center, the nurses would gather at the station because they knew how excited he would be. He gets so excited to see Murphy that they wanted to watch. They also knew that they were going to have a good night, that they weren't going to have to worry about too many behaviors from this gentleman. So we followed him every week for over a year. He was difficult to place because of his background. He ended up in a group home. We followed him there. They had difficulty getting him out of bed, but not on the day that Murphy came. And they had difficulty getting him to go for walks, not on the day that Murphy came. And I did have someone walk with us just in case there was an issue, but we never did have an issue. He was moved to Regina I wasn't allowed to say goodbye because they were concerned he would be too upset. Since that time, was contacted during the pandemic, and we were able to visit him virtually. And now again, just recently, I've been contacted again and asked to go to Regina to see him in person. So this person remembers Murphy, even though he hasn't been there in almost 4 years now, but the benefits of the dog are still there. And Murphy, when we did our virtual visit, he recognized this gentleman's voice. And most of the time in the virtual visits, the dogs are they don't pay too much attention to the screens, but he did in this one. The last story I will tell you, if you've seen any of the publicity that went with the last research, there is a picture of Murphy laying across a man's belly. And that particular person we visited in the ER. And at the time, I didn't know that that man was close to passing. A few years later, when I'm looking for volunteers to be sketched in my book, I'm in the ER and his widow comes up to me, and she was okay. She was with somebody else who was okay, and asked if Murphy was Murphy. And I said yes. And then she told me the story of how much her husband's passing was so much more peaceful because of Murphy's gentle presence. And she had kept those pictures. This was 3 years later. And she had kept all those pictures. She showed them all to me, and she let me use them however I wanted to. So I encourage you all who are watching to try to become a St. John Ambulance Therapy dog, because what you will get back is far greater than what we give. When you watch your dog enjoy the pets, my dog practically runs into the ER. He gets so excited when he's going in there. When you get to watch your dog excited, people feeling so much better, it feels you give a lot, yes, and it's quite the process, as you have heard, to become a St. John Ambulance Therapy dog, but it is so worth it. Your heart will fill, I promise.
Thank you, Jane. Thank you for sharing that. And I've watched Jane and Murphy. I've been visits where Jane and Murphy have been there, and Murphy is a pretty happy dog, pretty pleased to be visiting, and that's quite obvious in watching him and watching Murphy and Jane work together. It's quite a treat. So thank you for sharing that, Jane. It's much appreciated. We are now at the end of our panelist sessions. I've been watching the chat off and on, and I'm seeing lots of questions. So I'm going to just stop for a second and ask or open it up to anyone who's been monitoring the chat. Is there anything that you want to share? Or if there is anyone who has not had their question answered, feel free to bring that forward. So maybe, Ben, I'll just turn to you quickly. Anything that you're seeing in the chat?
Yeah, well, one thing is I see the application package that Michael sent out into the chat, and a lot of people seem very interested in that. Of course, that's why we're here. We'd like to become therapy dog teams. So if I could ask Michael to add that to the chat one more time, and so that everyone can see it, and so that we're all talking about it right now. And then also, if people are having trouble finding it, or if they can't download it from the Zoom, or they would like to discuss it further, Stephanie has offered to, if you want to email her, she will follow up with you about getting a therapy dog evaluation. So Stephanie, if you wouldn't mind putting your email in the chat, just so people can be aware of that. It's, I think, speechy.3. And so I think that would be a great thing to kind of start with. And then I've been watching it, and there's been a lot of very interesting questions. One that I saw that never got answered was actually, is there a maximum age for a therapy dog?
Stephanie, can you answer that?
Absolutely. There is no maximum age. There is a minimum age. We would prefer the dogs be about 18 months to 2 years of age to be evaluated for the adults. There is no maximum age. My dog, who passed away at almost 17 years, was still being a therapy dog at 16 and a half. So there is no age where they can't be evaluated or that they can't be a therapy dog. One of the things that we do is a young dog may be able to walk far distance. As they get older, they may not be able to walk as far, or they may have other needs that they have to do. We can accommodate that as well. So maybe when my dog was younger, his name was Dude. When Dude was younger, he went to the hospital and ran miles. As he got older, he ended up going to the prison, to the men's correctional center, where he went and walked into a room and they came to him. So we can accommodate older dogs and we can accommodate the younger dogs, but 18 minimum age is kind of what we want.
Thank
I
you.
also see, oh, sorry.
No, go ahead, Stephanie.
I also see, can there be any breed? We have a 6 pounds dog. We had a 160-pound dog. All breeds are welcome. 3-legged dogs, blind dogs, dogs that have hearing difficulties. We have no, we don't even look at those things. A therapy dog is something that people can get, can feel good about being with. And a dog that's got hearing problems, they really don't care if you talk to them or not. They just want to be there. And so you can talk to them as much as you want. Maybe they don't hear, but it doesn't matter. So all breeds, all ages, we don't really have any limits that way. The same way with the handlers. We have had in the past handlers who have had hearing problems and other difficulties. We can always try and accommodate those as well. So we really don't have any concern about that either. We do ask that when you fill out your paperwork, you let us know some of those things, that your dog can't walk a long distance, it's an older dog, but we really don't base our therapy dog program on that. We don't. Also, there was one more I wanted to, okay, I'm sorry, if I think of it, I will answer it here.
That's okay. I've been watching several questions come through, and I see that they're being answered. There was a question about therapy dogs visiting in Prince Albert. I saw that was answered. Stephanie, you answered the question about the related to the breed of the dog. I just recently saw a question about how do you balance between playtime with the dog and then the visiting time. And I'm just going to look to anyone here if they want to answer. Ben, you might want to take that, or.
Sorry, I was looking at the chat. Could you repeat the question?
Oh, there was a question just around person had around balancing, informal and playtime, and how might that impact then on their work when they're going to do visits? Is that going to have any impact?
Oh, well, that's a great question. That is something that we do test for, because at one point, if you watch the evaluation video, we try to get the dogs as revved up as we possibly can, because they're dogs and they have their own spirits and they have their own everything. And so they should be allowed to play and be amazing dogs outside of their therapy dog work. But it's just something that you have to be cognizant of, and you have to focus on being able to calm them down, being able to get them in the right headspace for the right situation. And so having times, and what I try to do with my dogs, and it's not necessarily worked, is have calm times at various stages where we're not playing, and it's very clear, and I sit them down and we sit or we stay and wait somewhere. Another thing that we do is when we go to a new space, we let him sniff all the way around and let him smell the new things, and so he's a little more comfortable in the situation. I'm not sure if anybody else has anything to add to that, but yeah, Colleen.
Yeah, the one thing people often ask is, how do I train my therapy dog? Or how do I train my dog to be a therapy dog? And we also say, you can't, right? You can train in the basic obedience, like the things Ben is talking about, but it really is their personality and whether they like to be out and visiting with people with you as their handler, right? So a lot of times people think, oh, I'm going to take this test and I fail. Oh, it has nothing to do with that. It's about whether your dog likes to be out and about visiting people and strangers and that they enjoy that, right? So there is, obviously you can do basic training and you saw in the video the things you need to do, but oftentimes people get a puppy and say, well, I want to start training him right now to be a therapy dog. It's just not possible. It's who they are, who their personality is, plus that basic obedience, right? So I just want
to thank you, Colleen. And I think that also ties really well back into the animal welfare too, that we are always coming back to, is this dog suited for a therapy dog role in visiting? And many are, but some aren't. And Holly mentioned this as well. It might not be their thing, but it's really about that dog's sort of temperament and personality and really wanting to be with people and do that visiting. I saw a question about visits at the correctional center. Visits are not happening right now at the correctional center. That may be changing in the future, but as of right now, they're not happening. That's in part due to COVID. So that might be something to continue to check on down the road for sure. I just want to mention too that the questions around obedience, we have a real range of people and dog handler teams who are here. Lori and Winston visit lots and lots and lots. And Lori also competes with Winston in obedience trials. So back to the question, can I be doing one thing with my dog, but also another thing, will that have an impact? It really depends on your dog, for sure. Other questions, anything else that we might have missed?
There was one much earlier that I saw that I thought raised a good point, is they were asking for a checklist for a team of do's and do nots. I'm not sure such a thing exists, but they gave an example of dogs must not jump up, etc. I just wanted to pose the question to Stephanie specifically, is what are dogs not allowed to do specifically when they're visiting? And what will fail them as well when they're doing an evaluation?
A couple things. One of the big ones is that if a dog barks, it can bark because it's getting upset, but it can also bark in a friendly way. And so when a dog barks, somebody may take it as, oh, that's a friendly bark, or somebody may say, oh, they're getting it mad and that's a mean bark. What we need to know is that the dogs don't bark, so nobody questions it. So we encourage no barking just because people might question, is it a mean bark? But we know that dogs bark when they're happy. My dog barks a lot when he's happy and excited to see me, but we know that's normal. But just when we're visiting, we can't have them do a lot of barking. The other thing that we discourage is jumping up on anybody. And that is one thing, mainly because if you went to a senior's home or you went to somebody who was unstable when they're standing and your dog jumps up on them, you could actually knock over the person. So we don't encourage that. Even a little, 15-pound dog jumps on your leg, it could trip you. So you have to be aware of that. So we don't allow that. Any type of aggression towards people or dogs during the evaluation, we have to stop the evaluation and we have to determine, was the aggression just a one-time thing? Is it something that we think could be corrected? Sometimes with evaluations, we will ask you to come back. We will suggest you work on certain things. One of the things that Ben does often is when we're doing the evaluation, puts a hat on and sunglasses on, and he uses a really deep voice. Now, some dogs really shy away from that, and that's what we're evaluating. Does the dog shy away? And if the dog does get quite upset about that, may even barks, those kind of things, what we might do is say, okay, we're going to stop the evaluation here. We are going to have you work on that at home, get somebody to do that exact same thing, and then come back and be reevaluated. Just because you had a dog that barked during the evaluation, or a dog that is really kind of aggressive towards people or is growling, we don't always say you can't be a pet therapy team. We have to kind of figure out, are you a good therapy dog handler that can work with them and help the dog to come back to be reevaluated? So we don't really have any specific things except aggression. We don't encourage jumping. We don't encourage barking. We don't encourage any type of feeding. So when you're evaluated, we don't want you to give them little snacks. You can praise them all you want. You can give them lots of positive things, but we just don't ask that you snack them. Is there anything else that Jane, I forgot, or Ben?
I think-
Thank you.
Licking. Don't you discourage licking as well?
Thank you very much, Holly. Yes, licking is another one, because we're not sure if people have cuts and those kinds of things. So licking, it may be that if they lick, that could cause a problem. Also, sometimes people have very thin skin, and if the dog licks it and really does a good lick, it could actually break the skin of some of the seniors who have very thin skin. So we often just discourage that. Again, we don't want them to lick, just so that we're safe with everybody. And the other thing I didn't mention, when we do the evaluation, we really are evaluating you for all places. We're not just evaluating you because you want to go and visit at the correctional center, at the hospital. We're really evaluating, can you be a therapy dog team? And we choose a spot for you, but we really want to evaluate you as if you could go anywhere that there is a requirement. So we can't just say, okay, well, I only am going to do this situation, so I don't have to do these other things. No, we're evaluating you as a therapy dog team for all places. Yes, Holly, go ahead.
I might have missed this, but I think we missed, and I think it was my error. I think we missed that the evaluation in general in that first process is only for visiting adult places, and predominantly adult places. And then if you want to specifically visit with children, after you're a therapy dog team for a year, you can be evaluated to visit with children. I just, wanted to add that.
Absolutely. Thank you, Holly.
Thank you. Thanks, everyone. I see the questions in the chat have kind of slowed down a bit, and hopefully they've all been answered. If not, you can certainly reach out to Michael or Stephanie for any other questions that you may have. There's lots of information in the chat. There are documents, there are links to documents that you might need. And in particular, that evaluation video is incredibly helpful. So I am going to wrap us up for tonight. We are thrilled with the turnout of people who are interested. It is so exciting. I want to wish everyone the best of luck with your dogs at some point. If you're going to be testing, wishing you all the best. And I will just look around the room here from our panelists. If there's anything else, Colleen, I'm going to turn to you. Any final words to wrap up?
No, I'm speechless. I don't have anything to add. Anyone else want to give a closing?
I think we're probably good. So thank you, everyone. And we will sign off. Thank you.